People who are born with heart defects age into adulthood due to the surgeries that have been very successful, that have been performed in the pediatric population. And so those patients have unique problems and issues as they go into adulthood related to the surgeries they had in childhood, and then also the typical acquired cardiovascular disease that other people would have as well. Some common sequelae of the operations that people have in childhood is that some of the surgical repairs that are made start to leak as the surgeries get older. Sometimes prosthetic valves have to be replaced. They have a certain lifespan and they essentially just deteriorate and have to be replaced. Due to the surgical scars that are created with the reparative operations, there can also be a tendency towards abnormal heart rhythms that can crop up as people age. So those are all common issues that we deal with in that population. Now, many of these people are surviving successfully into adulthood. So in the past, many of them did not, but the surgeries have gotten more advanced and have been perfected. And so the surgeries have gotten so good that these children live into adulthood and are having productive adult lives with minor issues related to the surgeries they may have had as children, and we can still oftentimes fix those issues and keep them going. Some of it may be medical treatment. Some of the times they have to have redo operations, so valves need to be replaced. The good news is that nowadays there are a lot of percutaneous technologies, meaning things that previously had to be done through an open heart surgery can now be done in the cardiac cath lab using a much smaller incision, essentially a needle stick in the leg or in the groin area, and using a catheter, and the valve is actually placed on that catheter and advanced through the aorta, and it's inserted retrograde. So that, again, is a much smaller and less invasive procedure than an open heart surgery. And so those things can often be done and have a one-day type of a recovery period and be back functioning again.